Welcome back to Empowerment Nursing. I'm Linda, and this is Ashley, and we are nurse educators. You're tuning into our series In the Know, where we make it simple. Today we are talking about how to study smarter, not harder, using pictures for instant knowing.
So we have good news for you. Every single one of us has a photographic memory, and very few of us ever actually use this. You may deny the fact that you have a photographic memory. However, let us prove it to you. If we were to, say, for example, ask you to write a paragraph about what nursing means for you, we would give you 2 minutes or whatever and have you write out a paragraph about how you feel about nursing, etc. If we asked you to recite that paragraph 3 months from now, you might remember the main points of it, but you wouldn't definitely be able to recite that word for word. However, if we asked you to draw a simple picture in 60 seconds about what nursing means to you, if we were to ask you in 3 months from now what you drew as a symbolism of what nursing means to you, you would be able to tell us what you drew. Also evidenced by if we asked you which pictures are hanging in the bedroom of your home, you would know what's hanging on your wall or what's in your living room or your kitchen because they have meaning to you and you see them frequently. So we all have a capacity to remember pictures actually better than we can remember words. However, we don't often use this in our study process. You may be thinking, oh, but I saw tons of pictures in nursing textbooks and I don't remember those. Those pictures, however, weren't necessarily meaningful to you. Also, in the majority of textbook, pictures are very detailed, three-dimensional. They're not simplified. They often have words and labels on them, which make them kind of more convoluted for you to understand. But if you draw something super simple to represent a concept, you will instantly know stuff. And today we are going to prove that to you.
We took this knowledge and we incorporated it throughout our study program, and we get messages all the time from graduates after they write their registration exam. In fact, this week I heard from several grads who passed and said, I could close my eyes and I could picture it. I could picture what I drew. I could picture the mind map. I could see where it was on the page. And so this is really positive feedback that we get. We have drawing boxes throughout our textbook where you draw pictures that are meaningful to help you remember. Now let's make it simple. Ashley is going to demonstrate this concept and how it is incorporated throughout our program.
So I'm just going to draw a picture here on the iPad, and one of our favorite drawing boxes in our entire study book, and we often hear from graduates who write the registration exam and say, this single picture got me the right answer on my test. And that is in our textbook. It's located in the respiratory system chapter where we discuss in detail COPD, which stands for chronic obstructive pulmonary disease. And the picture we draw on this page in our drawing box, it says, think pufferfish. So we draw this little pufferfish here. We are not artists, keeping in mind, we are nurse educators. But we have a lot of fun with this. This is how we draw our pufferfish. You might be thinking, oh, these ladies are up to something. What's this got to do with COPD? It's got a lot to do with COPD, and let me explain how. So what is COPD, chronic obstructive pulmonary disease? It's a combination of chronic bronchitis and emphysema, and the clinical manifestation of COPD, among many things, is that the patient presents with a barrel chest. So I'm going to walk you through a brief exercise. I do this in all of our live reviews as well as online. It's a really good demonstration, even if you know somebody with COPD, to do this. So play along, take a deep breath in, and exhale your air. Blow it all the way out, all the way out, all the way out. Now inhale your air, take a big deep breath in, exhale your air, and stop. Do you feel the inflation within your chest? You probably feel a lot of pressure within your chest cavity, and that is exactly how COPD patients feel all of the time. And that's because one of the problems with emphysema is that they cannot blow out all of the air that they breathe in. So they end up with air trapped within their chest. We like to call that barrel chestedness. This is why we have a puffer fish. That puffer fish is inflated with air. Also, the nursey term for this, we like to call it, is anterior posterior diameter. So what does that stand for? Anterior to posterior diameter, anterior to posterior, so front to back, versus the transverse diameter, which is side to side, should be a ratio of 1 to 2. Put simply, the patient should be twice as wide side to side as they are front to back. But of course, a pufferfish is not, nor is somebody with COPD, because their anterior posterior to transverse diameter is 1 to 1, which is bad. That means they have a big rounded puffy chest. And so our pufferfish is chronically inflated with air and therefore also acid, because we get acid out of our bodies by breathing out. This pufferfish is not breathing that out, so he is full of acid. And why did we draw big lips? We draw our pufferfish with big lips because pursed lip breathing is the number one teaching and nursing intervention for COPD, and that is because they have air trapping. So if you breathe in and breathe out, normally you don't get half as much air out of your body as if you breathe in and you breathe out with your lips closed, like these big lips on our pufferfish. So you can see just in this very simple drawing, our COPD pufferfish, we know that COPD has chronic air inflation. The lungs are chronically inflated with air. Acid is not getting out, right? The patient is barrel chested. They have an anterior posterior diameter of 1 to 1. Pursed lip breathing is the number one intervention. We got all of that information, a whole bunch of that stuff is the right answer on your registration exam just by drawing a fish with big lips. And the great news is this is instant memorization. You will automatically know this when you get the question on your registration exam. So Linda's going to hold up here just to show you. In our textbook, of course, we have a full page devoted to COPD. It's a large topic. We do talk about in the textbook what COPD is, what the signs and symptoms are of it, the treatment, diagnosis, oxygenation specific to COPD patients, as well as nursing interventions and medications. But today we are talking specifically about not just COPD as a disease process, however, how one simple picture can lead to instant knowing.
We hope that this video has demonstrated how much there is to gain in drawing just a simple picture to assist you with complex concepts. And we've incorporated this throughout our study package.
So we invite you to subscribe to our live videos if you enjoyed this video, so you'll be notified whenever we are online. You can also join our YouTube channel. Like and share this video with your nursing friends, and be sure to follow our Facebook page. And check out our website at www.n-powermentnursing.com, where you can experience our free trial, which is the cardiac chapter, and view our complete study package. If you like the way we teach with neat tricks and drawings like this is how we teach all of the content you need to pass your registration exam and all of the systems in a complete NCLEX, PN, or CPNRE course package. And we guarantee you will pass with our program or your money back. So feel free to send us any questions you might have, and we will see you next time on In the Know. Bye for now.
Bye for now.